Once again, we find ourselves living in a parallel universe. According to this Fox headline, GOP accuses Dems of risking shutdown to restore illegal immigrant health care. Subtitle: Republicans accuse Democrats of prioritizing health care benefits for illegal immigrants over paying U.S. troops. Can we go back to the veracity of that claim, David? Because it's so much at the center of this whole debate, because you have both sides or each side saying different things. And I would love for you to clarify once and for all if this is happening and how the Republicans are getting away with perpetrating this falsehood.
Well, at the center of this dispute are the subsidies under the Affordable Care Act that have extended Medicaid to more Americans, and that support hospitals and others who provide services, and also help people pay for their insurance premiums. So Republicans tried in the first Trump term to abolish the Affordable Care Act. They didn't have the votes even within their own party to do that. So they're now trying to starve the Affordable Care Act by turning off the flow of money. Problem is the Affordable Care Act is pretty popular. The people who get the Medicaid, who are newly eligible for Medicaid, because it's now available to a much wider population than it was before, they like it. The hospitals who get reimbursed for emergency care people who they didn't used to get reimbursed for, they like it. And the many, many people who are buying healthcare benefits for themselves in individual marketplaces who get a subsidy to do that, they like it. And Republicans still don't like it. And there's an argument, they have an argument to make. But they're afraid that their true argument, the one that actually motivates them, will not be acceptable.
Which is?
Healthcare is a service like anything else. And if you can't afford it, you shouldn't have it. We don't subsidize people's Netflix subscriptions. If you can't afford a Netflix subscription, you don't get one. We don't subsidize your groceries. You need food to live, but if you can't afford a steak, you don't get one.
Healthcare is a privilege, not a right.
They think it's a commodity in the marketplace, something you should buy. And there's certain classes of Americans, older Americans who get it no matter what, very poor Americans who get it no matter what. But if you're not very poor or old, that if you can't afford it, you don't get it. That's their view of this.